very important particle, which is one of the most atherogenic, which means it causes the most heart disease, called LP little a. And that we find in 25% of the population. LP little a is that particle that if you ask, you definitely have a family history of heart disease, you want to get that checked out. Because if you have that LP little a, which 25% of the population has, you're more at risk of a heart attack earlier than people who do not have that particular particle. But these are what we call advanced lipid testing, which are becoming more and more of the norm. People say, why are you checking for LP little a when there's not a treatment for it? Because then I can motivate my patients to do all the other things to improve their lifestyle, eat lower carb, or eat lower sugar, because carbs and sugar equal inflammation. Your diet, your exercise, your stress levels, your lack of sleep apnea, these are all pro-oxidant. And so what we want to do as much as possible is live a anti-inflammatory, antioxidant life. Those biomarkers that you just talked about and I talked about are markers that we can see what is your level of inflammation, and then we can start addressing those inflammatory markers.
Dr. Mark Hyman, a prominent functional medicine doctor, has given a great metaphor that I use regularly with my patients, which is think of cholesterol as dynamite. You can put dynamite away in storage and it's not going to hurt anything, but you come around with a lit match and that dynamite can be a huge issue. And so your cholesterol is the dynamite and the lit match is inflammation. So, I tell my patients regularly that we need to look for that inflammation to know how aggressive we need to be with treating your cholesterol.